Hello and welcome to our online presentation. We are going to be talking about home health CAHPS, and this is part one of two. My name is Craig Christiansen, and I'm calling you from Pinnacle Quality Insight. Just as a quick introduction to Pinnacle Quality Insight, we are an approved HH-CAHPS vendor. We've got over 14 years of customer satisfaction experience working exclusively in senior care and long-term care, long-term health care. Our assistance with HH-CAHPS is designed to increase patient loyalty, provide a positive service image to the agencies that we work with, and increase inquiries. So let's go ahead and get into this. Part one, we're going to talk about HH-CAHPS, just general information. That's going to be our webinar for today. Brady Carlson will handle part two, where he'll cover the Pinnacle quality approach to HH-CAHPS and three different Pinnacle options. All right, to start off with, CAHPS stands for Consumer Assessment of Healthcare Providers and Systems. So it's actually a family of surveys, and the HH-CAHPS survey is specific to home health care. So HH-CAHPS is required by CMS to survey of 34 questions about home health, and actually the goal is for each agency, each home health agency, CMS's goal for them is to complete 300 surveys per year per agency, or as many as are possible. It's actually per provider number, or as many as are possible. If you don't do HH-CAHPS, you just choose not to do it, and your agency qualifies to do HH-CAHPS as a requirement. Then you do get a 2% reduction in Medicare reimbursement. So if you choose not to do it, there is that 2% reduction in Medicare reimbursement. Agencies that need HH-CAHPS, it's each separate Medicare provider number or CMS certification numbers, and it's agencies with more than 60 non-duplicated Medicare, Medicaid patients annually. Patients that are required to be included have to have had at least one skilled home health visit during the sample month and two during a 60-day look-back period. They've got to be 18 or over, and they can't be included in the sample size more than once every 6 months. So they couldn't have been included in the sample 5 months prior to being included in that sample. They can't be currently receiving hospice care or have maternity as their primary reason for home health care. And they've got to be a Medicare Medicaid patient. HH-CAHPS is required. CMS has listed three reasons. One is to allow the public to create objective and meaningful comparisons between home health agencies. So to allow somebody to compare one agency to another if they're choosing an agency for themselves or their loved ones. Also to create incentives for agencies to improve the quality of their care. So if you know the quality of your care is going to be publicized, it's going to be made public, the whole goal here is to create that incentive to improve the quality of your care. And then third, to increase the transparency of the quality of care provided. That's just for anybody in the public, who through taxpayer dollars they're contributing to Medicare, Medicaid. So just to increase the transparency of the quality of the care that home health care companies are providing. How will results be published? They'll be published on Medicare.gov under the Home Health Care Compare section. There'll be a year's worth of results online. They'll all be published at one time, a year's worth, and then they'll be updated each quarter, so rolling results. A quarter will drop off, a quarter will be added, and then there'll be that year's worth of average. And you can have the industry, state, and specific agency comparisons that will be available. Here's a representation of what that's going to look like. You can see here, this question being addressed here is how well did the home health team communicate with patients? And out of the 34 questions, there's several that just address this issue of communication. It's called a composite measure. And you can see here that the United States average for all of those questions, the average is 92%. So it's a very high national average. The state average is also 92%. So it's a high state average. Riverview is at 90%. Sheridan's at 70%. So if I'm trying to choose a home health care company, agency for myself or my mom, my spouse or whatever, and I see those two options there, I'm going to pick Riverview every time because they communicate better. Communication's key, as with any relationship. You want to make sure that you have that good communication. So you can see here it gives a very objective comparison here, and also you can see the opportunity for maybe a smaller company or maybe just a company, an agency that's in a very competitive marketplace. It's a good opportunity to improve the quality of your care so that you do have very, very high scores so that when somebody's making that comparison, they're going to pick you every time. All right, your agency responsibilities. First, you've got a contract with an approved vendor. That's really kind of your first priority, is to pick a vendor that reflects the type of service that you provide. So pick a vendor that provides that, well, like I said, reflects your service level. Determine your initial service month and your method for submitting patient data. Is the vendor going to interact directly with your software company? Are they going to interact directly with you? Are you going to send the updates every month? Is your software company going to send auto updates? And just make sure that patient updates get sent every month. Avoid influencing your patients in any way about how to answer. Of course, review your survey results every month and register for login credentials at homehealthcaps.org. And go on there and authorize the approved vendor that you've chosen. The timeline proposed by CMS, and this is the final ruling, up until June 2010 and through June 2010 is what's called voluntary participation. So nothing is going to be submitted to CMS. The results aren't going to be uploaded, all that stuff. So starting July, August, or September, so anytime third quarter, you can choose 1 month or multiple months to do what's called a dry run. That's where we actually do submit the results to CMS, but it's practice. The results aren't made public. October 2010 begins mandatory participation, and January 21st of 2011 is the dry run results deadline. April 21st of 2011 is fourth quarter. That's when the fourth quarter 2010 results are the deadline for submitting those results. Okay. Now, you'll see a significant lag time here between the fourth quarter and April 21st of 2011. So there's 3.5 months after the fourth quarter ends. The reason why is because of this right here. This is the service timeline. Mandatory participation starts October of 2010. That's when you have to have what's called your first service month. Okay. Now, just for simplicity's sake, let's say that your service month is in January of 2010. To explain that 3.5 month lag time, I've included this slide here to kind of explain that 3.5 month lag time. If January is your service month, you've got the 21st until the 21st of February to deliver patient information to your CAHPS vendor. Starting the 21st of February, the vendor would have 6 weeks to contact and to conduct those surveys, contact your patients, conduct those surveys. After 6 weeks or before, if they can get them done sooner, they deliver the results to you, to the agency. So you can see the total turnaround time from your service month, the beginning of your service month, where you just provide care, just business as usual, you're just providing care. The total turnaround time to receiving your survey results about the care you provided is about 3.5 months. So that's very important for agencies to realize when you decide when you want your first service month to be. If you want to wait all the way till third quarter and just do a mandatory run, that's fine. That's your decision. However, you won't have results from that dry run for a few months into the mandatory participation. So agencies that are starting sooner than October or sooner than third quarter, they're starting as soon as January. The reason why they're doing so is so that they get results in April from January. They have a chance to make any corrections that they want or that they can to the quality of their care, and then they're improving the quality of their care so that by the time October rolls around, they've made adjustments and made corrections and made changes to the quality of care they're providing, so that when we're surveying their patients after October, in November and December, we're surveying them about November or October's care, then they've had the chances to improve the quality of their care. So I know that hopefully that all made sense and clarified things a little bit. This pretty much wraps up this part 1. For any other questions regarding HH-CAHPS, feel free to email us here at the email address here, inquiries@mycaps.com. You can go to mycaps.com. You can go to our blog at hhcaps.blogspot.com, or you can just do the old-fashioned way, pick up the phone, 801-293-0700. One of our CAHPS extras would be happy to explain any of these slides a little more completely. Again, my name is Craig Christiansen. This wraps up part 1 of HH-CAHPS, the general information session. Tune in to Brady Carlson's part 2 presentation where he covers our specific technical options. Thanks for joining us.